So I want to tell you a story, and it's a story I've told lots and lots and lots of times because it's one of those definitive stories for me using point-of-care ultrasound. So I was working in an emergency department, and a 4-year-old boy had been left at home, and he was unattended, and he found a firecracker in a drawer. And he lit that firecracker, and it exploded inside his closed hand. And literally, it blew off all his fingers. And he arrived in the emergency department having gotten some IM morphine, but he was in an extreme amount of pain. So what did we do? We quickly gave him some intranasal fentanyl, and then the residents at that time, under my supervision, we did a forearm nerve block, blocking his median, ulna, and radial nerves. And literally, within 15 minutes, probably sooner, he was pain-free. And he sat with his grandmother and watched a movie for 6 hours until the OR was free and the plastic surgeons could repair his hand. Now, what's impressive about this story is that at the time that we did this, many of us who had trained in emergency medicine were using this technique, but this wasn't really a new technique for pediatric emergency medicine. It was 6 years ago. And at that site, the nurses and the physicians and the surgeons and the anesthesiologists that were part of this case were so blown away with how effective and timely the pain control could be that they all wanted to learn the technique. This was one of those positive sentinel moments that happens in emergency medicine that changes people's perspective of what you can accomplish using new technology. And it's really one of those cool stories that I love to share with everybody.